I'd love to start by saying welcome, and my name is Elizabeth Prindle. I am an advisor at SAS Financial Advisors. Some of you may know me, and really loving what we do here, helping our clients and client households put their financial planning and financial investments together, and definitely appreciate all of our clients in that regard. One topic that comes up in every financial plan, although the timing may not be exactly at that moment of the plan, is the choices regarding Medicare. And we have two experts today who are great resources for understanding the next steps and more advanced topics for Medicare. Today, we'll be starting with the basics because there's a lot out there. I semi-joke that you couldn't even, there's several PhDs worthy of learning everything there is to do with Medicare. It can be complicated, but with the help of both Tiff and Katie, you guys will get an introduction to Medicare 101 and the kind of high-level, most important topics to be focusing in on. At the end of the webinar, we'll also be following up in how you can get in touch with Katie and Tiff regarding Medicare choices or questions. We're happy to make an introduction if you email your advisor, and that's probably going to be the best way to get in touch. We'll also have this video recorded and can offer that to refresh the content later. All right, I'm going to hand it off to Katie first for an introduction.
Thanks so much, Elizabeth. Tiff and I are really happy to be here tonight. As Elizabeth said, Medicare 101, lots of bits and bobs as you're approaching the age 65 or as you're transitioning to Medicare in general. We come from a family-run health insurance agency based in Marin in San Francisco. And Tiff and I are kind of the go-to. Our parents started the firm actually about 35 years ago. So lots of expertise, still a consultant in the background, but Tiff and I run a lot of the day-to-day. We primarily focus on Medicare, so specifically Medicare supplement plans, and we'll talk about that more in the webinar, and then also small business employee benefits. So those are our two kind of bread and butters, and we love to chat and try to help people orient what goes where as you're getting to the age of Medicare. A little bit about myself, born and raised in Marin. I live in San Francisco now, went to school all the way in Georgia at Emory University, came back, had a job, joined the family business, and working with Tiff and our parents on a day-to-day basis has been really rewarding. So that's a little bit about me. I'll hand it over to Tiff.
Hi folks, I'm Tiff. I'm Katie's sister. Katie and I both co-own San Francisco Health Insurance Agency. I'm also based in SF, but we do Medicare all over the state of California. And we're really happy to partner with SAS Advisors and to meet you all today.
Perfect. I will go ahead and share my screen with everyone.
Just a quick disclaimer. We love to refer our clients to Tiff and Katie. There are no referral fees exchanged. We're still fiduciary fee-only advisors. So it's just because our clients have been pleased with the service and level of care that Katie and Tiff provide to them in making Medicare choices. Great.
Right. Thank you, Elizabeth. And I guess I'll add that working with a health insurance broker is always free. The way that we get paid is any commissions from any plan that you buy from the carrier. So that's something that we love, that we always get to interact with people and do have conversations with no pressure and no fees. And the presentation that we're going to give today is one that we do typically on a one-on-one basis over Zoom, just like we are now, but in a group setting. It's a Medicare 101 presentation. Thanks, Katie.
Perfect. Yeah, we like to think of ourselves as just consultants for Medicare, providing as much information so that our clients can make an informed decision and feel like they have enough resources and information. So Medicare 101, our family used to be really big into comics. So we took this one, put it at the front, essentially, right? Everything's piling up until you get to 65. I personally can't wait to get a Medicare supplement plan myself because it's almost 100% coverage. And our dad is over 65 now, and some of the plans have gym perks. And so I swear every day of the week he's trying a new class for free because that's just part of his Medicare plan. So as we mentioned, I'm Katie on the left, Tiff is on the right. We'll share our contact information later, but we're from San Francisco Health Insurance Agency. There's a lot of bits and bobs of Medicare. So this page is a very, very high level review of it. The first part of Medicare is called Part A. A is an apple, basic hospital coverage. And then there's Part B. B is in boy, basic outpatient coverage, everything outside the hospital, completely different bucket. Together, Part A and Part B make up what's called original Medicare, or you might hear some people say traditional Medicare. This is the red, white, and blue card that you or your friends or your family members have had and seen that you get from signing up on the Social Security website. Now, on top of Part A and B, which is really basic, typical government benefit coverage, people often get additional coverage on top of it. So they'll either get Part C, which is also referred to as Medicare Advantage, or, and it's an or situation, you get a Medicare supplement plan, often referred to as a Medigap plan, plus a standalone drug plan. And we'll talk more about all the different pieces of it, but just so you can orient yourself, you either have, 3 different moving parts, Part A, Part B, and a Medicare Advantage, or you have Part A, Part B, a Medicare supplement, and a drug plan. Diving into Part A, the way it works if you just had your Medicare card and no other coverage on top of it, you turn 65, you apply, you have your red, white, and blue card, you get hospitalized. The way that Part A would work is if you stayed in the hospital 0 to 60 days, everything would be paid for except about $1,600. If you had to stay 90 days in the hospital, everything would be paid for except about $12,000. And if you had to stay 150 days, not that a lot of hospitals allow you to stay that long anymore, you could be on the hook for another $48,000. And so altogether, you could potentially be on the hook for $61,000 if you had to stay an extended amount of time. Part A is free. If you've worked in the US for 10 years, it's also referred to as premium-free Part A. If you haven't worked in the US for 10 years and contributed to payroll taxes, there is a set cost for Part A, and you can reach out and we'll kind of delve into the different costs of that per month. But in general, for most people, Part A is free, and it's what you've been contributing to in your payroll taxes.
I have a quick question on
Yeah.
those amounts. Do those amounts that you pay listed here go up frequently over time or with inflation?
They do change with inflation. I believe last year, the 90 days was about 11,000. So it just incrementally goes up, and it's just all up to how Medicare determines the price each
Great.
year.
And Part A, the 3 months before the month you turn 65, the 1 month you turn 65, and the 3 months after you turn 65. That's a 7-month time frame when you are pretty much compulsory is supposed to sign up for Part A. Is that right?
Yes. So if
Okay.
you are coming from an individual policy, so not through an employer, and you are 64, turning 65, you are required to sign up for Part A and Part B, either 90 days prior to your birthday month, or 3 months after your birthday month, in order to avoid any penalties. Now, if you are still working and you're turning 65 and you have employer-sponsored coverage, there's a really good chance, and sometimes there's different scenarios, but the general rule of thumb is you can delay Part A and B without any penalties until you lose those employer-sponsored benefits. So definitely good scenarios to keep in mind, and we always review, and we're happy to do like a side by side, whether it's worth
Sure.
staying on the employer plan or transitioning to Medicare, and doing a cost benefit analysis. Great questions. A quick review of Part B. So this completely different bucket of care. This is everything outside the hospital. So this covers outpatient medical expenses, primary and specialist visits at the doctor, any types of tests, MRIs, CAT scans, blood work, EKGs, ambulance and ER, outpatient surgery, all falls under the Part B bucket. And the way it works is you pay a $240 annual deductible, and then you pay 20%, Medicare pays 80%. However, unlike a traditional health plan, this 20% it does not have a maximum out of pocket. It doesn't have a ceiling of $8,000 to $9,000. It actually has unlimited exposure. So it goes to infinity. So some people most people get very nervous. What if I get really, really sick and need ongoing care throughout the year? I don't want to pay 20% of $1 million if I don't have to. And so this is just to highlight how basic Part B is, but it is the benefit that you get when you sign up for Medicare through the government. Part B, you do have to pay for. The base rate in 2024 is $174.70. On the next slide, you can see that it is based on income. So I'm sure Elizabeth and Monique and the team at SAS have mentioned something called IRMA to you, income-related monthly adjustment amount. And that's based off of your adjusted gross income plus any qualified capital gains or dividends. If you are single and make less than $103,000, or you're married for tax purposes and make less than $206,000, you will be entitled to the base rate of Part B, which is $174.70. If you are single or married, depending on which bracket you fall in and where your income falls, your Part B will be more each month. There is a more specific breakdown. They tend to do a breakdown of Part B IRMA and then Part D IRMA, but we tend to find the monthly cost kind of the best big number to think about. When you first turn 65 or you first sign up for Part B, Medicare, Social Security, IRS, kind of like Big Brother, they all talk to each other. And so they'll actually go back 2 years to your tax returns and go off of your income that you filed 2 years prior when you first turned 65. After you are signed up on Medicare, each year you file your taxes, they'll adjust it. So if you filed something and your income went way lower, they'll adjust it. If an event happens, oh, sorry, go ahead.
Well, the math here, the 174.70 is the monthly cost per Part B per household member or spouse, effectively. So if you're in the top IRMA bracket, $675 per month per spouse. So it's nearly, $1,000 more. So yeah, $1,000 more in the household for that year, based on, and if it's 2024's premium rates, this would be based on 2022's tax return. So
correct.
I think that's okay. Great.
Yeah.
Thanks.
Great question. Clarification. Tiff, anything else to add?
I would say even if you're in the top tax bracket, that's shown here, and you're paying $675 per person per month, so $1,200, $1,300, $1,400 extra. It still ends up, if you think about the cost of someone staying on an employer plan, if you do have that option or any other option, it still ends up actually still being a little bit net cheaper than an employer plan. And you also tend to get a much, much larger network and better benefits if you were to sign up with a Medicare supplement. That's the only thing I have to add.
Yeah, and to counter that as well, if you are not getting employer benefits and you're 64 years old, you're going to be in the highest age premium bracket for any health insurance carrier out there. So more than likely, even if you're on the lowest cost plan and you don't have insurance anywhere else, you just buy a policy directly from Kaiser or Blue Shield, it's going to range anywhere for the cheapest plan from $1,200 to $1,400 a month. And so big picture, often moving to Medicare can be less money for those who are coming from an individual plan as well.
And the IRMA premium also applies to the Part D if you have traditional Medicare for prescription drugs. And if your income drops, then those, based on your tax returns, the additional premiums can also go back to a base rate as well. So,
correct. Yeah. And if you ever have a change of income, the Medicare and Social Security, you can submit an appeal for your Part B premium based off of a qualifying life-changing event. Here on the left is a list of the ones that they will consider for, and work stoppage, so retiring, or you go to part-time, your income drops for that reason, marriage, divorce, death of your spouse, loss of income producing property, loss of pension income, employer settlement payment. I'm sure there are extenuating circumstances as well, but Social Security has generally advertised these events as something that they would reconsider and lower your Part B. In order to lower your Part B, there's a couple of forms that you file online, and then you would also attach and send in your most recent tax return as proof that your income has lowered. And then it takes about 30 days for them to give you a decision, and then Social Security will send you a couple other documents confirming that they received it and give you your new price. So just keep that in mind when it comes to IRMA. Something that a lot of our clients say and hope that they would be able to appeal their Part B is if they sell a residential property. Oftentimes that'll boost your income, and a lot of times you will just have to pay the inflated IRMA until you file your next tax return.
I've seen this, an appeal successful with work stoppage related to disability. So I know that that's an option there. And I mean, if you do quantify it, particularly with Bay Area real estate sale or selling residential property, and your increase in premiums throughout the year somewhere around 12, maybe 13,000 for the 1 year. I mean, the best you can going into it ahead of time, knowing that is empowering in and of itself. So you can, reflect that in the way you negotiate your sale price potentially. So just keeping that knowledge is power in a certain sense when you can't appeal for selling residential property.
Right. Perfect. Great point.
And I will say that most people who do this do get approved. We don't hear a lot of folks who are getting denied.
It's good to hear.
Perfect. The first step, of course, as Elizabeth mentioned early on, is applying for your Medicare card, which is on the right-hand side. You'll see that Part A is listed in Part B, and then the effective dates. And so again, you have 3 months prior to your birthday. So if your birthday was today, May 7th, the first time that you could apply for your card on the Social Security website would be February 1st. And then you can also apply 3 months after the month of May and avoid a penalty as well. However, if you're coming from an individual plan, that is a lot of money each month. It's to your benefit to stay on top of it and apply as early as you can, because you will save more than likely some monthly premium there. Unless you're really on the top end of the IRMA bracket, then it can be a toss-up.
This is a clarifying question for me. I know when my mom turned 65, she's a couple years older than my dad. He was on an employer plan at the time, and she was covered as spouse. But when she turned 65, she was still signing up for just Part A. Is that typical in how, you might see that happen? And then when employer coverage ended, she as spouse, her coverage ended, and she would apply for Part B and the other parts at that point.
Yeah, that's a great point, and something that we come across often. The general rule of thumb, if you work for a company with more than 20 employees, you can delay Part A and delay Part B without any penalty. You can also sign up for Part A if you want. The way it would work is you would have your employer plan, and then you'd have your hospital coverage. So if you're hospitalized, your employer plan or your spouse's employer plan would pay first, and Medicare Part A would pay second. And you saw the hospital coverage. It would be great secondary coverage to have, because if you had to stay less than 60 days, it would be very low cost. So it's always a good idea to sign up for Part A if you want to, but you don't have to if you work for a large company.
Compared to being 65, you have no coverage. Yeah, and you're transitioning from an individual plan, we'll say, and signing up for Part A and Part B. If you don't sign up for Part B in that 7-month window, I believe, is it a permanent rest of your life penalty assessed on Part B premiums?
Yes,
Okay.
there should. Yes, there is. We often don't come across too many clients. We try to catch them 6 months prior to when they turn 65.
Sure.
So we haven't come across any Part B penalties, but yes, definitely something
Great.
to keep an eye out. If you work for a small business, so less than 20 employees, I think we're still getting information on this, but we're pretty conservative in our office. We would recommend signing up for Part A just to be safe because there's no harm in it. Part A would actually be primary, and your employer insurance, if you have less than 20 employees, is secondary. And then you can delay Part B without penalty.
Great.
Yeah. Perfect.
There are a
And
few
then
cases in which you might be able to delay Part A as well. And we can go into the weeds with you if you're interested in hearing more about that. Yeah.
Great. So this is the sign up link. Yep. All right.
yeah. Great. So you'll sign up on Social Security, and everything will be through Social Security until you get a Medicare number. When you get a Medicare number, then you'll also get access to a Medicare.gov account. So it's a bit confusing, but you always start at Social Security until you have a Medicare number. And if anything income related, you'll go to Social Security. Only for benefits, once you're signed up and you have this card, will you go to Medicare.gov.
Okay.
Yeah. Perfect. So just to review of Part A and Part B, you have that hospital exposure if you were to stay in the hospital for 5 months or more. And then Part B, you have that $240 annual deductible and that 20% co-insurance that doesn't have a cap or a max. And so people get pretty nervous and they want to lower that exposure, right? And so going back to the options, you can either take a left, get a Medicare supplement plan or a Medigap plan and get a standalone drug plan on top of it, or you can get a Medicare Advantage plan. We'll talk about both of them. As I mentioned before, Tiff and I, our office, we only specialize in supplement plans. One of the reasons is we believe really strongly in a Medicare supplement plan if it's within the client's budget. The coverage is phenomenal, and you have the largest list of doctors you could ever go to. And in terms of the price comparison to an individual plan, it's just a no-brainer. If it's within your budget, you'll go Medicare supplement plan if you want comprehensive care. Medicare Advantage plans are great in general if you have a lower budget and you know how to work a system that can function on a more limited network or an HMO network. So if you've ever been on a managed care network before, whether it's Kaiser or a Blue Shield HMO or a United Healthcare HMO, and you know the system and the ins and outs of a medical group, then a Medicare Advantage could work for you if you were trying to save money and it's not within your budget to have a supplement plan as well. There have been, and Tiff can speak more to this as well, there have been kind of, I guess, we try to stay impartial and provide as much information as possible. We believe in supplement plans more, but beyond that, Medicare Advantage has been getting some bad press because they've been known to deny certain claims and to try to lower costs. It's more of like a profit balance on the Medicare Advantage side. And so there are a lot of members who sign up for a Medicare Advantage and they're not able to get the care that they want. So we just wanted to touch on that as well, but Tiff can go into more detail about it too. Yeah, go ahead, Tiff.
I guess one thing I'll say is that the structure of the plans is radically different. With a Medicare supplement plan, you'll go to the doctor's office and they're going to bill Medicare Part A and Medicare Part B, and then Medicare will reimburse them money according to the benefits we saw before. And then what they'll do is they'll also bill your Medicare supplement carrier, and that's going to pay for most of the rest of the bill, but you retain Part A and Part B, and then the Medicare supplement. With the Medicare Advantage, it works pretty differently in that the government will take the money that they put towards your care for A and B and they'll give it to a third-party carrier, for example, Kaiser or Anthem or United Healthcare. And those carriers, the government tells them, go make a plan for your client and your patient, and they'll make a plan, and it often ends up looking a lot like an employer plan or an individual plan where you've got co-pays and a deductible and a maximum out-of-pocket cost. And there's a lot of incentive there for the company to then deny prior authorization requests because they already have the money in their pocket, and the less they spend on you, the more money they make. And in that case, you do have to pay for Part B, but if you go to the doctor's office, they're not billing Medicare Part A and Part B and then your Medicare Advantage. They just bill your Medicare Advantage plan. Thanks for letting me take over, Katie.
Yeah, perfect. I know I'm a visual person, so sometimes I do a little annotation just explaining what Tiff was saying too. Both Supplement and Advantage are government subsidized plans. The way that a Medicare Advantage plan is subsidized, as Tiff mentioned, is the government will give an allowance to a specific carrier, Kaiser, United Healthcare, Blue Shield, as Tiff mentioned, and they'll create that benefit plan that they'll then put to market and offer to 65-year-olds. This is considered the Medicare Advantage plan that you can buy. And as Tiff said, it's in their favor to control a lot of costs. So it's completely up to Kaiser or United Healthcare to approve or deny what type of care you're asking for. Oftentimes, Medicare Advantage plans are structured as an HMO where you do need referrals. There are a couple of PPO plans, but it's a narrow network. So you have to stay within the network, and it's generally less choice. Often, prescription drug plans are embedded within the Medicare Advantage plan, so you do not need a standalone drug plan. And then you'll hear a lot, especially towards the end of the year, the open enrollment, there's a lot of push for, so there's a free vision plan and groceries and dental and hearing and all of these great, great benefits. A lot of our clients will call us and say, what is this? Why are we not on this plan? And they really try to grab your attention by throwing out these like happy benefits in front of you. But if you take a step back or you dig a little deeper into the plan, depending on how you want to spend your money each month, right, and what's within your budget, it's not going to be nearly as comprehensive as a supplement plan. Oftentimes, the maximum out of pocket, which is the worst case scenario, if you get really sick on a Medicare Advantage plan, can range from about $4,500 on the strongest plan to about $6,500 for the year. The premiums tend to be either free, which is very attractive, or about $70 a month. So very reasonable premiums for the coverage that you get, as long as you understand how your Medicare Advantage works. On the flip side, a Medicare supplement plan, also government subsidized, Congress said, hey, we are going to create Medicare supplement plan A through N, and we are going to allow health insurance carriers like Blue Shield, United Healthcare, Anthem, sell these Medicare supplement plans, but they can't change the benefits. And so if they want to put it on the market, the only thing that they can change is the premium. We're deciding what the benefits are, and we meaning the government. And oftentimes there's no referrals that are needed. You can go to any doctor or specialist that you need. You have access to any doctor that takes Medicare within the US. And then you do need a standalone drug plan on top of it, because a supplement plan is going to be very strong medical coverage, but it has no prescription drug coverage. And oftentimes, some of them, depending on the ones you get, they'll have like a strong gym membership partnership program to encourage you to move. In general, in the Bay Area, for a 65-year-old, the premiums for the strongest supplement available to you, which we'll delve into, is about $145, $130 per month. The strongest plan, if you are turning 65 now or moving forward, is called a Plan G as in George. And the way that a Medicare supplement plan works is you pay a $240 annual deductible, and then you're covered 100%. And so what happens is all of that exposure here on the right-hand side, the Plan G comes in and it takes care of that hospital exposure, and it takes care of that 20%. And so the only thing that rolls over is the $240 deductible. And again, you can see any provider that you want. We say about 90% of providers take Medicare. The ones that we see don't are the concierge doctors or the really successful orthopedic surgeons who just don't want to take insurance at all. Something that I will note, if you are, a Kaiser person for life, had them for 25 years, something that we have seen specifically for people moving out of Kaiser is just finding a primary care doctor in this specific doctor landscape. That's been one of the biggest feedbacks we've had. I've prevented people from moving from Kaiser to a supplement plan. Is just simply the doctor shortage in the whole country has really affected who's taking new patients and all of that. The way that the supplement plan G works, in a quick example, is let's say you see, a dermatologist and they cost $1,000 for their visit in the office. The dermatologist office will first send it to Medicare. Medicare Part B, Medicare in general will say $1,000 is a little steep for a dermatologist appointment. We'll allow $500 because that's what the doctor who's contracted with Medicare agreed to. So we'll allow $500. And then let's say Tiff is on a Medicare supplement plan G, they'll say, oh, has Tiff paid her $240 deductible this year? And if she hasn't, they'll say, okay, dermatologist office, you can pass on $240 and bill Tiff because she has not met her deductible yet. The remaining amount, the $260, on just original Medicare, right, you would typically be responsible for 20% of the remaining. Medicare is responsible for 80%. But on the Plan G, this 20% is then sent to your Plan G provider and they cover it. So they fill in the gaps. And that's why it's also called a Medigap plan. So that's just generally the order of operations when you do have Medicare Part A and B and a supplement plan. Moving on to kind of the estimated cost, just so you can see it more linearly. Part A and B, you have to have no matter what when you transition to Medicare. And so whether you go Medicare supplement or Medicare Advantage, you'll see that Part A and B are always there. The part that you can choose is whether you want a supplement plan and a drug plan, or if you want a Medicare Advantage plan. And these premiums for Part B are based off of the lowest income bracket.
One question that comes up, or something I know Ira always points out, is if you're maybe, it's poor wording, but on the fence between traditional Medicare and a Medicare Advantage or a supplement Medicare Advantage, choosing to begin with the Medicare supplement solution is a good strategy. And later you could choose Medicare Advantage if that was something that made sense for you. Switching the other way, starting with a Medicare Advantage plan and later switching to Medicare supplement solution could involve higher premium rates than, might otherwise be the case if you had started in the reverse. Is that the understanding there? Or
yeah, half of it is spot on.
Half is okay.
And then the other part I could definitely clarify as well.
Thank
you.
Thank you.
Ira is definitely correct. It is easier to start on a Medicare supplement plan. And if you change your mind, you can switch to a Medicare Advantage plan during the open enrollment period every year. So every year you have an opportunity to switch to a Medicare Advantage. The same is not said going the other direction. If you choose a Medicare Advantage plan first, you're forfeiting your open enrollment to a Medicare supplement plan without health questions. And so if you start with a Medicare Advantage and you keep it for 2 years, let's say, and you say, you know what, I really want more choice. This Medicare Advantage plan isn't working for me. You will then have to answer health questions and go through health underwriting to get on a supplement plan, unless you meet a specific guaranteed scenario, meaning you moved out of a Medicare Advantage service area, or the rates increased in a certain capacity that it meets the underwriting rules that you don't have to answer health questions. If you're healthy, it's no big deal. You can switch to a Medicare supplement plan, and it'll be fine. If you have had a history of something, any type of hospital visit, the health questions vary from carrier to carrier, you most likely won't be approved. Sometimes carriers will have like an underwriting holiday, meaning they'll forego the health questions. But essentially, Medicare supplement plan carriers know that their product is stronger, and they don't want people who are healthy to go on the Medicare Advantage plan, save money, and then when they're sick, switch to the Medicare supplement plan and be a loss leader for them. When it comes to the premiums and the price, they're always based on age and where you live, and that won't change whether you go Medicare Advantage or Medicare supplement first. It'll still be very linear of you'll just go to essentially the rate table and find at that time how much your premium would be on a Medicare supplement plan.
Medicare Advantage plans, though, do tend to be the same price regardless of age, so they don't actually go up as you age. That's one thing I would add.
That's true. And neither of these are based on income as well. If someone is also on the fence, let's say they're a lifelong Kaiser person, but they're having trouble picking a doctor, there's one of those guaranteed scenarios that we like to tell them. It's called the trial period. And so if you join a Medicare Advantage first and you don't like it, within 12 months, you can switch to a supplement plan without any health questions. Essentially, they know that people like supplement plans. They'll try Medicare Advantage. Some people won't like it, and they'll go back to a supplement. And so they give you this trial period to come back. But if you stay 13 months or longer, you'll have to answer health questions.
Okay. Thank you for the clarity on that.
Sure. The last bit and bob is the Medicare Part D, the drug plan that goes along with the supplement plan. It really varies based on every individual's drug needs. There's 22 different drug plans in the state of California. And what we do to shop, and we're not the brokers for the drug plan, but we'll help you navigate the site, is you'll go to Medicare.gov, enter in all the drugs that you currently take on a daily basis. It runs it against all the different formularies of the 22 different drug plans, and it pops out what is going to be the least out-of-pocket cost for you, depending on the pharmacy you go to and the drugs that you take. Because, right, you could be on a really cheap drug plan per month, but your drug cost could be insanely high. And so at the end of the day, it might not be cheaper than going and paying more for a more expensive drug plan where your drugs are cheaper. So Medicare.gov does like an algorithm math for us. Tiff, I don't know if you want to expand more. I know it's kind of hard to explain without demonstrating exactly the shopping process that you and I go through with our clients.
I think in short, what folks here probably need to know is that in order to find the best plan for your drug plan, you're going to want to have your exact list of drugs and enter them into the Medicare.gov website, just like Katie described. The way that Part Ds function is pretty complicated and different with every plan. So there's no best plan for Part D, which is surprising to a lot of folks who are used to paying more money to get a better plan. It doesn't quite work that way. Yeah. Katie, would you add anything to that?
No, I think that's a great point. It's even, you and your spouse, your drugs are different. You could be recommended very different drug plans. The cheapest one in 2024 is 40 cents. And then it can go all the way up to probably 180 per month. But generally, if you have a very, very expensive drug, there is a cap. It's $8,000 in 2024. It's an $8,000 bucket, not only what you pay as the member, but what Medicare kind of subsidizes as well. So you can hit that bucket pretty quickly. Just something to know in terms of legislation. Next year in 2025, they're lowering that bucket, that shared bucket of responsibility, to $2,000. So there's more and more protections coming in for people on really expensive drugs. And so it's hard to say how much that would cost. If you are interested in pricing out your drugs Tiff and I could go through individually with anyone who had specific questions. On the topic of drugs, if you have an employer plan and you're still working, one of the big things that we see is if you have an expensive drug, it will more than likely be better covered on an employer plan than on a Part D. So that's one incentive to keep your employer plan longer if you're still working and you have access to it. The drug plan is not that strong, but when they first created the Medicare program, they didn't have any drug program. So our dad likes to say that a program is better than no program.
And the Part D is optional. So you don't have to have a Part D, and we certainly have a couple clients who've decided to forego it because they didn't want to pay for something when they weren't going to use it, at least for 10, 15 years. And that is an okay choice, but there is a penalty for not joining when you do qualify to join or when you get Part B, and that penalty is 1% per month that you've had Part B, but not Part D for drugs. That ends up being 12% per year of what, you may ask, of usually the median drug plan premium as determined by the government. It's typically about $35. So 12% of $35 per year added every month onto your drug plan cost is what they would add. And I would say currently the prices are so low, 40 cents per month, that it makes a lot more sense to be on a Part D, even if you're not going to use it. Just sign up for the cheapest one, and you can change it every year for January 1st if you need to.
Perfect.
Great.
I think that was one of our last slides, just a high-level overview. We covered Part A, Part B, and then the biggest choice that you have to make is whether you go supplement plan or Medicare Advantage, and then pricing out that drug plan if you do go with the supplement plan. But we're here to answer any follow-up questions. Elizabeth, is there anything that came to mind that we didn't touch on?
I think this was a really good overview of the essential basics. If any clients or others are interested in having a chat with you both, we're happy to make an email introduction to the two of you along with our client. However, we are not exclusive to that. You are welcome to contact them independently based on the email addresses you see here as well. So lots of ways to get in touch. We'll also have this Zoom webinar posted on our YouTube channel and then embedded on a landing page on our website indicating the same, how they can reach out to you or to contact their advisor for an introduction as well. Great, thanks. Maybe a note, you guys also do small business
Yes.
group plans as well.
Yeah.
So if there's ever a question on that, we can send your way as well. If you want to describe a little bit of that high level, that would be great.
Yeah. Do you want to touch on that, Tiff?
Absolutely. So we do small business, which is typically 0 to 20, 0 to 30 employees. And that's considered group insurance. We also do, as you've seen, Medicare, and we also know individual insurance. So if you're trying to navigate between any of those three categories, which are the three categories to navigate in terms of commercial health insurance, we should be able to do that. Oftentimes, folks who are retiring and joining Medicare Part B may have a spouse who's under 65 and not qualified yet. And folks are also wondering, well, what do we do for our kids? Maybe they need to sign up for Covered California now that they're their own tax household and filing their own taxes. All of those things will come up. There's also a question of, oh, we're not quite 65 yet, and our premiums are really expensive, but we do have a really small business. What qualifications do we need to start the small business so that we can get better rates than our health insurance? Because group insurance is about 15, 20% cheaper than individual insurance. And we can help you figure that out as well. Typically, whenever possible, it is a good idea to be on group insurance over individual insurance, just because it's cheaper and gives you better options.
Yeah. And a better network. A lot of individual networks, even on a PPO plan in California, limits you to the state of California. and is a smaller network in general. Doesn't include Stanford and the Bay Area. If you are on the same company but a PPO plan through an employer, you'll have the largest list nationwide that you could access. So if you need top care at a certain facility and it's not a network, you have the opportunity to have a business and health insurance plan. That's often one of the scenarios where we help kind of our smaller groups sign up, is because they need access to a better network.
Perfect.
Yeah.
Thank you.
I have one question about switching from the Medicare Advantage plan over to traditional Medicare. When you talk about the health questions, are those the type of questions that impact the premium?
No impact on premium. No impact on premium. It's just whether you are approved or denied.
Okay.
There is, if you smoke, there's technically a tobacco premium increase, but that often doesn't come up with a lot of our clientele. But that's the only thing.
So in that regard, if people choose Medicare Advantage first and then later decide that they want to switch, they may not have the option to switch.
Correct. If they are sick, they might not ever be approved to go on a supplement plan.
That's helpful.
Yeah.
Yeah.
I think,
sorry, Katie, you go.
Oh, I think for all the people watching the webinar, something that helps guide our clients through is just thinking, you're healthy now. You could save money by going on a Medicare Advantage each month. And if something happens, you could be on the hook for a couple $1,000s. Or you could go on a supplement plan and pay a higher premium. But if something happens to you, you at most pay $240 for medical coverage. But the real guiding question is, if I get really sick in my 70s or my 80s, what access to care do I want? Am I comfortable staying within a specific network? Or do I want more choice? And so those are some high-level questions we find our clients asking themselves as well, choosing between the two.
And you do have the option of going with neither of these. You can have original Medicare, which is just Part A and Part B. Optionally, you could have Part D without a Medicare supplement and without Medicare Advantage. You'd have to know that in that case, if you go to the doctor, you pay $240 and then 20% of your appointment. If you have a surgery, outpatient, you pay 20% of that surgery. So it could be, 20% of 30,000 or more, if it's a replacement, perhaps. And if you go to the hospital, it'd be $1,600. But we do meet people who have been on original Medicare for many years. And at the point when they're talking to us, they're probably looking to switch, but it is very possible to stay on A and B. And I also want to talk more about the pros of Medicare Advantage. One reason to stay on Medicare Advantage or to go with Medicare Advantage would be to stay with Kaiser. If you really like Kaiser and you definitely want to stay with Kaiser, Kaiser only offers a Medicare Advantage. Kaiser is a managed care plan. It's an HMO. The way that it works only works with Medicare Advantage. So that's one reason to go Medicare Advantage. Also, if you can't afford a Medicare supplement, the Medicare supplement premiums will go up as you age to about $200, $250 for one person per month. Then Medicare Advantage is a better option, depending on your budget.
Yeah.
And also, if you know that you want to use Sutter or another HMO network, and you're not someone who needs a lot of choice, you're someone who might be okay knowing that you'd have to sit with a denial of a service or have to fight that, and you may not be able to go see a specialist that you want to see. As long as you know those things, some people can be very happy with Medicare Advantage, especially because they're the types of systems where you don't have to research the doctors that you're seeing. So the flip side of that is no choice, but they will refer you to the doctor that they want you to see. And some people like that coordinated care aspect. They also sometimes offer transportation and some vision insurance and some very limited dental insurance. You don't get to choose your dentist, and oftentimes the dentists are not getting paid enough to spend a significant amount of time with you. So the dental care is pretty low quality, but they do include that. It is something. And so if you have a hard time getting around, maybe the transportation would come in really useful, etc. On the flip side, some of the hardest calls that our office has had to take are when folks are on Medicare Advantage and they get diagnosed with something very specific and they want to travel to see the best specialist for their diagnosis, and they can't do that. That is very hard. Yeah. I would also say for anyone who has houses in multiple states or multiple parts of the state and travels a lot, that's a good time for a Medicare supplement because it will work throughout the country and it will work seamlessly.
That came up today, actually. I have clients 57 and 59 ages, and they have a home in the Bay Area and a home in Nashville. And so, you know, with retirement imminent and employer provided health insurance ending soon, I was quick to mention, hey, by the way, we have a webinar. So we'll send them this information as well. So thank you for clarifying that.
What about earlier in the session, I saw in the chat, there was a question about international coverage and relevance of the Medicare supplement program, Part F, I think it was. Is that easy to navigate, or I don't know if that's like a very case specific type of question or if there's just some general knowledge, but it seems like several of our clients have looked at potentially living abroad in retirement or otherwise. So that would be helpful information.
Yeah, it's a great question. A lot of our clients also ask, you know, I'm going on a trip. What is my international coverage like? Because they are worried about something happening abroad. I can only speak to the supplement plan because that's our bread and butter and we do the deep dives into it. On a supplement plan, international coverage is really basic. If you have a plan G, and I also believe a plan F, which Sandy was mentioning. And the reason I didn't mention plan F before, it's no longer offered to people turning 65 after 2020. It's considered a grandfathered supplement plan. If you are on this webinar, you're past 65 and you have not signed up for Part B yet, it's available to you. It's 100% coverage. It was too good to be true, so Congress took it off the market and made people sign up for Plan G instead, which is the strongest plan. When you are abroad and you have a supplement plan, you have a $250 deductible. Then you pay 20%. The supplement pays 80%. Up to a lifetime maximum of $50K. So it's very basic coverage. We often recommend if they're looking for something like they want, and it's only for emergencies. So if they're looking for something where they can see a doctor because they got really bad cough, but they're abroad, we recommend looking at travel medical insurance. And we have a contact for that if people are interested. But generally for shorter trips, travel medical coverage will be your best option. And then if you live abroad, Medicare won't be of use to you because you'll just have the emergency coverage outside of the US.
You could still theoretically retain it. And when you come back to the US, if you wanted to, and Katie, did you mention the 6 weeks?
Yeah, there are certain stipulations. It has to be within a certain time period, 6 weeks of the start of your trip for the supplement plan to cover you for emergency outside. So if you're traveling for years or a year, you could be outside. There are limitations to the international coverage. Essentially, it's a loss leader for them to cover people outside the US, so they make it pretty basic.
I'll probably put that client in touch with you guys too for additional questions.
Yeah, great.
Awesome. Well, thank you.
Another
both
question
very
that,
much. Oh yeah, no, please.
Okay, so G, you might see a lot of different plans or hear about friends who run plans other than G and F. As Katie mentioned, F is grandfathered, and if you're turning 65 now, it's not an option to you. If you turn 65 before 2020, it is an option. If you're thinking about G, versus F, there might be some pros and cons you could consider. With Plan G, the way that it works is really beautiful and elegant. You get billed $240 the first time you see the doctor, maybe January, February, March. And then after that, all of your doctor's visits and hospital care is free. With Plan F, you'll never get that bill for that $240 deductible. So that's even more elegant. For folks who are having trouble keeping track of their bills or who think that they might as they get older, you might want to stay on Plan F. But even when you add back in that $240 deductible, Plan G is net cheaper in the premiums. So Plan G is the go-to in terms of it's the maximum amount of coverage, it's the cheapest price, and it's one of the simplest plans to be on.
Right. And if there's anyone on the webinar who does have Plan F, and if you haven't shopped for a while, that's something that our office often does as well. We find that as you get to the age 70 to 75 and older, it'll be worth to shop the competitive landscape, because a Plan F, no matter which insurance carrier you buy it from, or a Plan G, will be the same exact benefit. It's just, you're basically just shopping for price. And so it can save you a couple $100 to $1,000. We've moved clients previously to save money, same exact benefits, just a different carrier. So if anyone wants to shop or anything like that, we can also have a conversation with them.
You may also see a lot of cheaper plans that aren't Plan G, and all of those are actually priced more expensive than Plan G currently by the main carriers in California because they're trying to drive folks to Plan G. So they'll have worse benefits and be more expensive.
One other thing that we didn't mention is, let's say you choose a supplement Plan G, or you currently have a Medicare supplement plan. You can switch carrier to carrier, as I mentioned previously, during your birthday. It's called the California birthday rule. You have 60 days from your birthday month to switch to an equal or less benefit Medicare supplement plan. So you can go G to G, F to G, to another carrier. So you always have that window of freedom. So you can always shop during that time.
Is that in addition to open enrollment?
So that's where it gets a little bit confusing. So the general Medicare open enrollment that you hear about and see TV commercials are for Medicare Advantage plans.
I see.
That's like a 3-month window at the end of the year for January 1st, and then it extends a little bit. Medicare supplement plans, you can only switch during your birthday once you're signed up. And then the drug plan, even if you're on a supplement plan, the drug plan has their own special enrollment period, which is October 15th to December 7th. So if anyone has a supplement plan, doesn't want to shop, but they just want a webinar later in the year about a refresher on how to shop the drug plan, you can reach out to us as well, and we'll shoot you a link. We do a couple webinars towards the end of the year just to shop drug plans as well. So a couple different timelines to keep track.
This is amazing content. It's extremely valuable to us as advisors, as well as us as individuals, and hopefully helping and benefiting our clients and yours. We're coming up to the hour here, so I think we'll come to a close. But again, contact your SAS advisors. Anywhere it says clients book on the SAS webpage, there's a button there. You can click on our headshots to book some time, or just shoot us an email. You're welcome to also connect with Katie or Tiff individually as well. Happy to help as best as we can. Thank you so much to the two of you for offering this great information to our clients today.
Thanks so much for having us.
Great. Excellent. All right. Bye.
Bye.